single bill is not the entire plan. There are 3 different phases.
We'll have 218 when this thing comes to the floor. I can guarantee you that.
A new massive WikiLeaks dump detailing U.S. efforts to turn smartphones, smart TVs, and computers into spy tools.
Government's ability to spy on everybody at all times is sort of out of control and unchecked.
The agenda behind the Women's March, the Day Without a Woman, we're not necessarily talking about women's issues. We're talking more partisan issues.
So spinning him out right there. Very dangerous situation. He's going to get out. He's going to try to evade police. Yeah, he's going to be tackled from behind. And he's down. It looks like they tased him.
The state of Hawaii has announced it will challenge the Trump administration's revised executive order. To keep me off them. I know the song says, all right, no, mountain high enough. There are certain things that is just going to stop us from going.
Well, good. We like you here at work.
Good. Hey, by the way, there's nothing that will stop hackers for exploiting our intelligence agencies, and maybe the worst hack yet in American history took place against the CIA.
All right, so WikiLeaks releases 8,000 pages worth of documents, information, releasing how the CIA actually hacks, full of hacking capacity at the CIA.
It's devastating.
That's right. And that is the CIA headquarters in Langley, and that is exactly where the information was stolen, apparently from an isolated high-security network inside the Center for Cyber Intel. Here's what you need to know. You know, they sell your smartphone, for instance, Apple, the iPhone, and they say it's encrypted. And we remember the story about the San Bernardino terrorists where they, you know, nobody could get into the phone. Well, they've got a team, as we just heard from Andrew Peek, former U.S. Army intel officer. There is a team of 1,000 people working for the CIA to crack your iPhone. They've also apparently figured a way, if you've got a Samsung television with the little camera at the top, they can turn that on, they can listen to you, and apparently they figured a way with these self-driving cars to crash your car if they want to target somebody for assassination.
So whether it's Microsoft, your television might be off, they could be listening, a Mac, an iPhone, an Android, any smart TV, they could be using it to maybe look at a terrorist, maybe trying to find out what's going on in enemies like with China, like for Syria, what's going on with, for example, in Libya. But now all of this has been exposed. This, many people feel, and I'm one of them, is worse than exposing who these people are. They now know how we do it.
Like Snowden did. Snowden was exposing people. This leak is exposing how they're actually hacking into phones. And you know what was interesting, too? They can hack into your phone and listen to your conversation even if your phone is turned off. Some people say they're okay with it. If this is how we catch terrorists, then there's nothing to worry. If you're not doing anything wrong, there's nothing to worry about. You interviewed Andrew Peek. You were just talking about former U.S. Army intelligence officer. Listen to what he said.
The worst part of this disclosure is that there is not even a public service that really it supports. You know, when Edward Snowden revealed that the NSA was tracking who we called on our cell phones, that engendered kind of a necessary debate about privacy versus security. Most Americans, as you point out, know the intelligence community is trying to crack these electronic devices. And so the fact that now we know how they're trying to do it is really only useful for our enemies. The only saving grace to this disclosure is that it didn't disclose all of the NSA's tools, which would have been far, far more than the CIA's, for whom this is sort of a secondary mission.
Okay, so this first batch is called Vault 7. It's just the first of a number. It's something like 7,800 different pages, and it's got let's see, 943 attachments, little links. I was warned yesterday by somebody down in Washington, if you click on one of those links, there's a possibility that they will wind up installing malware on your smartphone, so don't click on the link. Don't know if that's true, just that's the word on the street.
And by the way, but if you do get an email saying in Nigeria there's somebody who needs your help, definitely help them.
I sent them $200.
Right, you have to, yeah. Again,
I haven't heard back.
Yeah, I don't want them to pay the price because of
Well, and they needed my Social Security number.
You should you gave it to them, right?
Maiden name and my date of birth.
That was smart.
Good
that
move.
was really
I'm just
smart.
trying to help.
You're a genius.
All right, so yesterday, that was one of the top stories, or last night. That's why we're telling you this morning. Also, another big story is Obamacare, repeal and replace. We saw that plan that the Republicans rolled out on Monday. The president was speaking about it yesterday. He was endorsing it strongly. He supports it, and he hopes that it passes quickly. Listen to what he said.
I'm proud to support the replacement plan released by the House of Representatives and encouraged by members of both parties. This will be a plan where you can choose your doctor, this will be a plan where you can choose your plan. And you know what the plan is? This is the plan. And we're going to have I think we're going to have a tremendous success. We have to remember Obamacare is collapsing. And it's in bad shape. And we're going to take action.
So what is the action? The Republican plan gets rid of penalties for businesses and individuals. That's great. You don't have to buy insurance if you don't want to. It defunds Planned Parenthood. And then for people who can't afford it, it winds up giving them tax credits. They used to call them tax subsidies. It's just a word thing. And some Republicans, conservative Republicans, say, look, it's still an entitlement and we're going to have to vote against it. Of course, this is round one. This is how negotiations start. They say that now. What are they going to say down the pike? Yeah,
the Texas chairman, Kevin Brady of Ways and Means, is firmly behind it. He's one of the authors of it. Paul Ryan is also a conservative for the most part, and he is for it. A lot of people are against it, including our guest in 10 minutes, and that is from the Freedom Caucus, Ohio Congressman Jim Jordan will be with us shortly. Meanwhile, here is Health and Human Services Secretary Dr. Tom Price on why the thing works.
This single bill is not the entire plan. There are three different phases. One is this bill that has to go through reconciliation that because it's a budgetary process. Two is all of the kinds of rules and regulations. You remember all the things that the previous administration did? Hundreds of rules, literally thousands of guidance letters. We're going to go through every single one of them to determine whether or not they help patients or hurt patients. And if they hurt patients, we're going to do our best to get rid of them. And then the third phase is another piece of legislation that can't be done through reconciliation because of the specific rules. Those are the kinds of things that we're going to do in those phase 2 and 3.
That should make the Freedom Caucus happy then, because they're going to have different phases and different opportunities to make the changes that they want to make.
Right, but they don't like it as it is. But keep in mind, this is how it's starting right now, and it's pretty clear from leadership that this is going to be the one shot. There's going to be the one bill, because Paul Ryan says we're going to start marking it up today, and that means while they've got that 66-page document that they essentially the framework, now they're going to start to write out the bill. He is very confident that they'll have 218 votes at the end of the process. And Mitch McConnell wants to ram it through as quickly as he can once it is passed through regular order in the House of Representatives.
Office Management and Budget still has to score it. No.
They don't know how much it's going to cost, which is a crazy thing to do. You know, it's hard to sell somebody something if you don't know the price. And right now we don't know the price.
Well, it's just like the president said. Bottom line is where we're going, the direction that Obamacare is going now, it's failing. These insurance companies are bailing out. The country cannot continue to afford this. So some things have to change. If you had entitlements and you're upset that they're being taken away, it's just that's the way it is. Before you didn't have the option of having insurance. Now you do. So basically these congressmen are saying you got to be happy that there is an option.
And I should have said CBO is going to score it, not OMB.
Congressional
Meanwhile, all right, so Abby Huntsman, we have the latest with the CIA hack. We have the latest for health care. Do you have anything else?
We've got some other headlines this morning.
That's right.
Yeah, we've got a lot of headlines. Good morning, you guys. Good morning to all of you watching. Starting with this one happening today. The NTSB launching an investigation into why a charter bus full of senior citizens stopped on train tracks before being smashed into pieces. First responders in Biloxi, Mississippi, cutting through wreckage to free the trapped passengers. 4 people are now dead, 40 injured. The bus taking passengers from a Texas senior center to a casino. Witnesses say the bus appeared to be stuck on the tracks for several minutes before that crash. Well, the left is already lining up to stop President Trump's revised immigration order today. Hawaii will file the first lawsuit to block it. The state's Attorney General Doug Shin calls it nothing more than Muslim ban 2.0. They want a judge to issue a restraining order on March 15th, one day before the president's new order takes effect. No comment yet from the DOJ. And hours from now, a Mexican immigrant dreamer facing deportation heads to court. Daniel Ramirez Medina was brought to the U.S. as a child and protected under the Obama administration. Well, the feds arresting Medina in Seattle after they say he admitted to being in a gang. His lawyers deny those claims and argue that his arrest violates his constitutional rights. Stay tuned for that one. And schools in at least 4 states shutting their doors today as teachers refuse to work on a day without women. Day without a woman. These schools and districts say they can't staff classrooms. Dr. Nicole Sapphire joined us earlier, and she says the protest won't bring women together. Listen.
So having some teachers stay home and some other people stay home, we're not actually coming together on a cause that women can all fight for together. It's organized by the same people as the Women's March. And although it's talking about women and coming together as a woman, really, if you read their unity principles, which they bring forth, it's more along the Democratic agenda.
One of the women behind today's strike is a convicted terrorist. Seen there, Resmia Yosef Oda spent 10 years in jail for her part in a 1969 bombing of a Jerusalem supermarket. Really probably frustrating for parents who have to figure out what to do with their students today,
exactly,
their kids.
Because they just announced that they were going to be closing schools, for instance, down in Alexandria, Virginia, whereas the teachers apparently, during your interview, I heard Dr. Sapphire say that apparently the teachers were going to have Friday off anyway. Now they're taking today off, too.
And it's also hurting me. I'm doing Outnumbered later. I don't know if I'm going to be alone on the couch.
Oh, yeah, the women might not show up today.
Yeah, it's going to be unbelievable.
I don't know. Most of the women I know need their salaries.
Okay, good. Maybe they will show up. Please let me know.
Meanwhile, we just talked about the Republican Party's Obamacare replacement plan. Next up, Brian's going to talk to Congressman Jim Jordan about why he wants a different version of the plan. Currently, the plan as is, he doesn't like.
And she was crowned Miss USA in 2006, but her darkest days were still ahead of her. And now
We didn't write this bill in my office on Christmas Eve like they did in Harry Reid's office and then jam it through to an unsuspecting country. These committees are writing this legislation. These committees will be marking up the legislation tomorrow, and then it goes to the Budget Committee the next week, and then it goes to the Rules Committee on the floor the week after that, which is regular order.
Wow. All right. But despite what Speaker Ryan said, some conservatives on Capitol Hill, you probably heard, are not happy with the replacement for Obamacare, including our next guest, who's introducing his own plan for a clean repeal later today. GOP Congressman Jim Jordan is a member of the House Freedom Caucus, and almost to a man, they are not for what was presented yesterday and does not think this should pass the way it is. Congressman, the Speaker was very confident he was going to get his 218. Does that include you?
No, not right now. Well, I think this bill has real problems, and I would say when we told the voters we were going to repeal Obamacare, we didn't say we're going to repeal Obamacare but keep some of the Obamacare taxes, which is in the leadership plan. We didn't say we're going to repeal Obamacare but extend and expand the Medicaid expansion. And we didn't certainly say we were going to repeal Obamacare but also start a new entitlement, which is what this legislation does. So what we're introducing today is consistent with what we told the voters we were going to do, and frankly what I think they expect us to do, and that is a clean repeal. Just repeal Obamacare, pass the exact same thing that every single Republican 15 months ago in the Congress voted for. Put that same legislation on President Trump's desk, the same thing we put on President Obama's desk.
So not only do you not like what's in it legislatively, which makes, I know, people's eyes glaze over, but the facts are, in the Senate, you don't have close to 60 votes yet, even though there's people in Trump won districts and all that. Having said that, so Speaker Ryan's looking practically, saying, you know, I want this, but to execute, I'm going to have to give you this in order to get the 51 simple majority. So he doesn't want a clean repeal and a clean replace, because it would mean 60 votes in the Senate, and he doesn't think he can get it.
Well, you can do clean repeal with 51 votes in this process called reconciliation, which is budgetary focus. So you can do the clean repeal, the same thing we passed 15 months ago. You can do that. But some of the replacement, you're right, will take to allow interstate shopping for insurance, to do what needs to be done on health savings accounts, to actually make it easier for association health plans to form. Some of those things and some of the regulations that need to go as well, that has to be done with the 60-vote hurdle in the Senate, which is obviously a little tougher because you're going to need 8 Democrats to find, to see the light and do the right thing. I get that, but that's what we told the voters we were going to do. Clean repeal and then replace it with a model that empowers families, and one that I actually think, and this should be the focus, brings down the cost of premiums. That's what people in the end care about. Working class families, middle class families care about the price of their premiums and deductibles, and right now they're going through the roof under Obamacare.
They are, and you believe if what Paul Ryan, the Speaker, put forward passes, it'll be the same thing, just moving chess pieces around on the same board?
No. My read of what was brought forward yesterday by the leadership, I don't think it's going to bring down the cost of insurance. I don't think it's going to bring back affordable insurance, because we still have regulation concerns that are out there. We still have to implement some of the things we just talked about, purchase across state lines, association plans, that sort of thing. Those have to happen. But let's start with what we all agree on.
Okay.
What unites Republicans? Clean repeal. Get rid of Obamacare, like we told the voters we were going to do.
Right. So, Congressman, how about this? If they're not going to do clean repeal, clean replace, can you get in there and get your hands dirty on what they have now? Or are you just going to walk away from it?
No. Of course, and this way it works. And this is American democracy. This is how it works. The bill was just introduced, what a little over, not even 48 hours ago. The American people would like to see it. So they'd like to know what's in it. They want to debate. That's what they expect. That's how our system works. So we're going to provide that. We're going to go into this. We're going to try to make this bill better if we can. But right now, where it is not, it's not what we told the voters we were going to do. And I don't think it's going to bring down the cost of insurance, which has got to be our goal.
I only have 25 seconds left, but I heard this is just the first phase. Can you put that in layman's terms?
Well, there's things that the Secretary, Dr. Price, can do that can be helpful on the regulatory side of this issue, and there's things that need 60 votes, which is the third phase that the Speaker talked about. But let's do what makes sense, what we told the voters, and what they expect us to do. Repeal it first, and that sort of puts a premium on getting things done. Then. Getting the replacement passed that will actually help the situation. So let's focus on that.
And the president's leadership could be and usually is invaluable in a situation like that since it's from your own party. Congressman, always great to see you. Thanks so much.
You bet. Thanks, Brian.
Straight ahead. Now the plan to replace.
It is a story about second chances. Soon after being crowned Miss USA in 2006, Tara Connor's world came crashing down because of substance abuse. But she says our president, Donald Trump, came to her rescue.
I've always been a believer in second chances. I've always been. Tara is a good person. Tara has tried hard. Tara is going to be given a second chance.
You see her tears. Now she is 10 years sober, and she is spreading her message of awareness to the 22 million Americans that are suffering with addiction. She has also penned an op-ed thanking President Trump. Now, joining me now is Tara Connor. She is an advocacy ambassador for Facing Addiction, a nonprofit organization. Thank you for being here. Congratulations on celebrating 10 years of sobriety.
Yeah, a decade.
Tell us what happened. What was your story? This was in 2006. You were crowned Miss USA.
I'm crowned Miss USA. 9 months into my reign, I failed a drug test for cocaine, and then it becomes this massive media circus and this huge news story. And Donald Trump had a choice. He could have fired me, or he could have given me an opportunity to get help. And thank God he chose to give me that opportunity, because it was a huge step forward for the recovery movement.
Did he save your life?
He started it. You know, I always have to give him credit for that, because had he not said in the press conference that obviously she's an alcoholic, maybe she needs rehab, I don't know that I would have been able to get treatment, because I know that on my own I wouldn't have been able to afford it. And I didn't even know that I was suffering from a disease because of the stigma.
If he had come out and publicly shamed you, it might have taken you down even a darker path.
Who knows? Who knows what could have happened? But I mean, I got the shame from everyone else for sure. Like, they were calling me Miss USA and like disgraced Miss USA, and I just, that's when the advocacy started, because I was so mad. Because,
well, you know, I'm reading your story. I'm reading your history. Tell the folks at home why you turned to alcohol and cocaine.
Well, my life was a perfect storm for addiction to manifest. I'm an incest survivor. I was abused at 3 years old.
By your uncle?
By my uncle. And my parents had a nasty divorce, but mental illness and alcoholism was very present in my family. And I just didn't have the awareness of what alcoholism or addiction was. There was no prevention programs in place except an egg on a frying pan, which just looked like a lot of fun to me. And there just weren't services. So the stigma was very much still alive, and I just didn't know that by me taking that first drink around 14, I was becoming close to 40% more likely to become dependent.
Wow. In your op-ed, you thank Mr. Trump. If he's watching right now, what is your message to him?
My message to him is that he has the opportunity to save so many lives, right? There's over 40 million Americans that are impacted by addiction, and it's not being treated as the healthcare crisis that it is. And, you know, thank God for the grassroots organizations who have been handling this for so long, like Transforming Youth Recovery and Facing Addiction, creating this huge umbrella of these nonprofits so that we have the resources and know where to go, but it's still not enough. So I encourage everyone who's out there struggling to go to facingaddiction.org and sign their letter to Mr. Trump, because we need to do something. Our kids are dying, but recovery works, right? There's a way out, and I'm just so grateful that I was given that opportunity, and I feel that everyone should have that opportunity, and it should be mandatory.
So he made you great again.
He made me great again.
Kara, thank you so much for being here. Congratulations.
Thank
we
you.
wish you nothing but the best.
Thank
God
you
bless.
so much.
You're welcome. Coming up, it was one of his most coveted campaign promises.
We will soon begin the construction of a great wall along our border.
Now the wall might become a reality sooner than you think. And now that the plan to replace Obamacare is out in the open, will it actually work?
Out to support the replacement plan released by the House of Representatives and encouraged by members of both parties. This will be a plan where you can choose your doctor. This will be a plan where you can choose your plan. And you know what the plan is? This is the plan. And we're going to have I think we're going to have a tremendous success. We have to remember Obamacare is collapsing. And it's in bad shape. And we're going to take action.
Well, now that the Republican Party's Obamacare replacement plan is public, we wanted to know, does it make the grade for all of us? Here for another doctor debate, we've got Fox News Medical 18 Dr. Mark Siegel, screen left, and Obamacare architect and Fox News contributor Dr. Emmanuel Ezekiel. Good to have you live here in the studio.
Nice to be here.
Dr. Emmanuel, let's start with what the president just said. He said that currently Obamacare is collapsing. Would you agree with that?
No. I think there is some uncertainty out there in the market, created largely by the Republicans, as to whether they're going to shore up the exchanges and do the things necessary. Remember, the main reason why there was some uncertainty had to do with taking away the reinsurance program by the Republicans. That created uncertainty. You also need to, I agree with this, encourage young people to get into the insurance market and buy insurance. But, by the way, getting rid of the mandate is not a way to encourage young people to buy insurance, and the alternative they have is not going to encourage them anymore.
Well, he says encourage people to get insurance, which is good, but under Obamacare, they were forced to.
Wait. Subsidies encourage people to get insurance. You pay most of the premium.
Steve, the mandate, let's start with that. I don't believe, as a practicing internist, that you can mandate that people buy insurance when insurance is not health care. In other words, you have insurance, but you may not be able to get the care you need, especially if the policy has a high deductible, like $12,000 or $13,000 on a bronze plan, and high premiums. The reason Obamacare is failing is because the premiums are too high and the deductibles are too high. So, if we can change the system so the premiums are lower and then encourage people to buy insurance with tax credits, I'm actually okay with that. The problem with the repeal bill, though, is that it doesn't get rid of the essential benefits that we talked about. Let me finish. The essential benefits that we talked about last time, where a young person is paying to cover a service that they don't need, those are still in. So therefore, the tax credits are a way of sucking you into a system where you get something you don't need.
Let's just make 2 points really clear about this proposal. Point number one, it keeps the essential health benefits for the exchanges. It does not get rid of them. Point number two is that the tax credits that the Republicans are giving are actually lower than the subsidies people get under Obamacare, which means their premiums will be higher or their deductibles will be higher. There is no other way of squaring the circle. If you give less subsidy to people to buy insurance, then they're either going to pay a higher premium or they're going to get higher deductibles. This plan doesn't answer your criticisms of Obamacare.
I agree with that point. I think essential benefits have to go. I'm believing catastrophic policy, Steve. I think that people should have the option to buy what's useful for them. We're going to bring in health savings accounts here, which is great.
Let's calm down and have a rational choice.
Let me finish my point, though.
What essential? I asked you last time what essential benefit were you going to remove, and you didn't mention one.
No, I did mention one, but the main point, I talked about maternity coverage, not everybody paying for that. Here's the main point I want to make.
But then,
wait. Here's the main point I want to make. I'm not against the government providing mammograms or colonoscopies or vaccines or emergency services. The problem is sneaking in, having somebody pay for it that doesn't need it. Let the government either provide free clinics or give money to insurance companies to pay for the person who needs the mammogram. I don't want a 30-year-old woman who's never going to have kids paying for maternity coverage for a woman who is.
Let's discuss that. If you say maternity coverage is not part of insurance, then you're basically saying women who have babies, you have to pay the full price, which is about $15,000. That is not insurance. That's just called pay for what you get. That's not insurance.
Well, that's choice.
Insurance. Insurance is spreading the risk over everybody. We all benefit, by the way, if a woman has good prenatal care and a good delivery, there are fewer
Right,
million-dollar...
spreading the risk over
I thought we were going to give chances for me to finish my comment. If you have good prenatal care, you give women insurance so they go to the doctor, they get a good delivery, you have fewer million-dollar babies in neonatal intensive care units, everyone benefits. Having good care is something that we all get a benefit from, and we all should support that.
If the government believes that a certain group needs a certain care for public health reasons, they should provide it. We don't need grannies in Iowa paying for STD screenings in New York.
Excuse me, maybe you don't know the latest data, but a lot of seniors have STDs.
I know you were going to say that.
Well, it just happens to be true.
He's picking on Iowa.
I want more choice in the system, Steve. I want catastrophic, because we all agree that people that go to emergency rooms should have coverage. Everyone agrees that vaccines should be covered. Everyone agrees hospitalization should be covered.
What about drugs?
Well, but the reason...
What about drugs?
Yes, but essential drugs...
Essentially, you've listed the 10 essential benefits, Mark.
No, I haven't.
All 10. The only thing you don't like is maternity care.
The reason premiums are so high...
You are discriminating against women. You just...
is covering too much.
Here's my question for both of you guys.
Yeah.
The President of the United States, when he was running, said, you know, regarding a replacement plan for Obamacare, he said everybody's going to be covered. Now, given what we've seen so far, is everybody going to be covered?
The S&P did an independent evaluation. That Standards & Poor's did an independent evaluation. They're estimating 10 million people are going to lose coverage by this new proposal. There are ways to get to universal coverage, and you know, I'll give you one that I think Mark and I might agree on, which is you have a government auto-enrollment into a catastrophic plan with not just catastrophic, with 3 visits to a primary care doctor and prevention covered. If you do that, auto-enrollment, everyone gets it, like Part A.
You're talking about where the government is in charge of...
No, not in charge. Forget the in charge. In Part, like Medicare Part A. You get it...
For everybody.
And you get it, everyone in the system, because we believe in catastrophic coverage. Mark agreed with me. We believe in primary care, 3 primary care visits, and prevention. That will get more people covered. And then you can save money by negotiating with the drug companies.
I have one caveat there. I don't disagree with that. And I also, by the way, agree with you
that sounds like you agree with me.
I also agree with you that Medicaid expansion should be preserved. That's for another debate. But listen, what I want to say really importantly at the end here is we don't have the primary care doctors to take care of any of these patients or to take care of this insurance, period. This insurance expansion, we have a shortage of primary care doctors. We're not paying them enough. We're not incentivizing their training. We don't have enough nurses. We don't have enough nurse practitioners. We put the cart before the horse. We should have started off with more doctors.
All right, great doctor discussion.
We actually agree a lot now here. You see this? Medicaid expansion should stay.
With Seema Verma managing it.
With Medicaid expansion should stay, and we should have a coverage, a system where everyone is defaulted into catastrophic coverage with primary care.
Bad news for you right now. Doesn't sound like that's what's going to happen.
We might move to it.
We need high-risk pools in the states, which we're not getting right now.
They're very inefficient.
Well,
no one thinks they're a good way to run.
Everybody's paying for everybody else. Socialized medicine.
Okay. Doctors, thank you very much for joining us.
Thank you.
Good to see you.
Well, that's great. What do you think about that? Email us, friends@foxnews.com. By the way, Dr. Siegel gives the new plan a B, and Dr. Emanuel gives it a D.
Sounds like great inflation to me from both of us.
All right. Meanwhile, coming up, he went on television claiming he can prove the Russian connection to the Trump administration, but after a social media firestorm, Democratic Senator Chris Coons now walking that comment back. He's going to join us later, that is to say, to talk about that. Plus, you grew up watching her as Winnie Cooper on The Wonder Years.
Something tomorrow. I mean, if you want. Yeah, I mean, sure, if you want.
That's right, Kevin. Well, actress Danica McKellar, now all grown up and inspiring kids with her brand new book. She's here to tell us all about it when we roll on live from New York City.
Hi, Delaware Democratic Senator Chris Coons walking back comments he made last week suggesting the FBI has evidence of Donald Trump's ties to Russia.
There are transcripts that provide very helpful, very critical insights into whether or not Russian intelligence and senior Russian political leaders, including Vladimir Putin, were cooperating, were colluding with the Trump campaign at the highest levels to influence the outcome of our election. To the extent those comments that you just replayed might in some way be misinterpreted as leading to a sort of hyperventilating attitude here in the Senate about this, I apologize for that. That's not what I was trying to do.
So where does the investigation go from here? Senator Chris Coons is going to be in the middle of that. He joins us right now. Senator, always great to see you.
Thanks, Brian. Good to be on with you.
All right, first off, Senator, what can you tell us new about the investigation 2 days in?
Well, first, this week, the Senate Intelligence Committee is getting access to the raw intelligence and transcripts of those intercepts that I was referring to last Friday. And if you just listen closely to the clip you just played, it makes clear what I was saying, that there is intelligence that will provide insights into whether or not there was some collusion between senior elements of the Trump campaign and the Trump administration and Russian intelligence and Russian officials. What I was trying to point to there, Brian, was that we need to get to the bottom of this. This isn't about partisan politics. It's about defending our democracy. We had a hearing yesterday on the State and Foreign Ops Subcommittee of APROPS, a subcommittee that's critically responsible for our support for our NATO allies and democracy in Western Europe. And we're going to have a joint Republican and Democrat speech on the floor later today about the importance of pushing back against Russian aggression.
I know you get sophisticated intelligence as opposed to watching Meet the Press, but on Meet the Press, the former National Intelligence Director said he saw when he left office January 20th, no collusion between the Trump camp and Russia.
Well, that's one person's perspective, and that's an important insight. What I was saying on Friday and what I'll say again today is that we need to get to the bottom of this. We need a thorough, fair, straightforward investigation where we get a report back in Congress about what Republicans and Democrats on the Intelligence Committee have found after they've had a chance to review all the evidence.
Senator Tom Cotton, your colleague, Republican side, said this.
The main consumer of intelligence from the intelligence services is the White House and specifically the National Security Council. So you have many partisan Democrats who are receiving this information, and I think there's a good chance that you might want to look to some of those partisan Democrats who left office on January 20th and are now being identified as former U.S. officials if you want to know where some of these leaks are coming from.
And a lot of that goes back to what the president tweeted out roughly on Saturday. And what Robbie Mook told us yesterday, former campaign manager with Hillary Clinton, that they were hearing about intercepts and reading transcripts between members of the Trump camp as well as Russian officials to some level.
Well, I think it's inaccurate to say that the National Security Council is filled with partisans. I think the National Security Council has proven itself over several administrations to be overwhelmingly full of career professionals who are providing the best support and analysis they can to the president. I also would just point out there are several different sources of intelligence, the FBI, the NSA, the CIA, and several others. And one of the things that's undeniable here, Brian, is that the entire American intelligence community concluded that Russia did interfere in our last election. And I think it's in the best interest of our democracy to make sure that we take this seriously and that we take prompt action on a bipartisan basis against that intrusion into our election.
And if you sense that Democrats are making this a partisan effort or an attack on Trump, will you come back on every outlet and say so?
If I think this has turned into nothing more than a witch hunt and there's no basis in reality for it, that is the position I take. Brian, you know me.
Yep.
But I also think there shouldn't be a cover-up. In the best interest of our country, we need to get to the bottom of this. That's why I was encouraged yesterday that the man who's the nominee to be number 2 in the Justice Department, who now that Attorney General Sessions has recused himself, will take over the direction of this, did say that he will insist on a free and fair investigation.
And his track record reflects just that. Senator Coons, thanks so much.
Thank you, Brian.
Meanwhile, straight ahead, you know her as Winnie Cooper from the Wonder Years.
Maybe we could do something tomorrow. I mean, if you want. Yeah, I mean, sure. If you want.
Don't you just want to watch the rest of the